From Yamato. Bring Japanese wisdom and modern science into your daily life. I'm Inyan Monk.
To all therapists and practitioners, in our daily clinical practice, we frequently encounter patients suffering from sciatica, don't we? There may be times when improvement is slow, or we feel uncertain about the most suitable approach. Regarding sciatica treatment, we have learned various methods such as muscle relaxation and pelvic adjustments. We've also studied various manual techniques and Eastern medicine perspectives. Of course, these are very important and effective approaches. However, are you aware that in recent years, particularly in Western medicine, the understanding of the causes of sciatica and related treatment philosophies have been gradually but surely evolving? It's increasingly important for us, as therapists and practitioners, to understand this latest medical knowledge. This is essential for providing safer and more effective treatments. Moreover, it's crucial for providing appropriate information to our clients and alleviating their anxiety. And the importance of this cannot be overstated. Therefore, in this report, I'd like to discuss a particularly misunderstood, yet clinically significant topic: new ways of viewing and thinking about MRI images. Let's learn together. A herniated disc on an MRI that's the sole cause of the pain. Can we really be so sure? Let's reconsider this common assumption together through this report. Chapter MRI basics and its role first. Let's briefly review. MRI is an excellent diagnostic tool for observing the inside of the lumbar spine in detail. It clearly visualizes the condition of intervertebral discs and nerves, which are difficult to see on X-rays. For example, it can show a disc protruding and touching or compressing a nerve, FC, or a narrowing of the spinal canal where nerves pass through. These findings help identify potential structural candidates for the cause of sciatica. Chapter 2. Why don't MRI findings always match symptoms? However, here is the crucial point. It's becoming increasingly clear that the findings in the MRI picture do not always perfectly align with the symptoms the patient actually experiences, such as pain and numbness. Why does this discrepancy occur? Let me explain the three main reasons in an easy-to-understand way. Reason abnormal findings are common in pain-free individuals. The first reason is that many people without any pain show abnormal findings on their MRIs. This is somewhat like natural age-related changes. For instance, wrinkles appear on our faces as we age, but having wrinkles doesn't necessarily mean that area hurts, right? The lower back is similar. Natural changes due to aging occur in everyone's spine. In fact, studies show that a significant percentage of healthy individuals without any symptoms have findings like herniated discs on their MRIs. Therefore, even if an MRI reveals a herniated disc, it doesn't automatically mean it's the direct cause of the current pain. It could just be an incidental finding related to aging. Reason 2, nerves can be more inflamed or hypersensitive than images suggest. The second reason is that nerves can be more inflamed or hypersensitive than the structural image might suggest. While MRI can show the shape of the nerve, it cannot accurately reveal the degree of nerve inflammation. Even mild physical compression can cause severe pain if significant inflammation is present. Furthermore, prolonged pain can cause the nerve itself to become hypersensitive. Think of it like the volume knobs for pain signals being turned way up. In this state, even stimuli that wouldn't normally cause pain can trigger intense pain signals to the brain. This nerve hypersensitivity doesn't show up on an MRI scan. Reason 3. Imaging can look severe, yet symptoms may be mild. The third reason is that sometimes the MRI findings look quite severe, but the patient experiences only mild symptoms. This can happen because the nerve may have adapted or become accustomed to the pressure, especially if it develops gradually over a long period. Alternatively, it could simply be due to the large individual differences in how people perceive pain. Psychological factors such as anxiety or stress levels are also known to influence pain perception. Chapter 3. Clinical application. The importance of comprehensive judgment for these reasons. While MRI is a very important source of information when investigating the cause of sciatica, hopefully, you now understand that it doesn't determine everything. What is crucial is to use the MRI findings as a reference point, but always combine them with the patient's own report and the findings from the physical examination to make a comprehensive clinical judgment. As healthcare professionals, we are required to adopt a multifaceted perspective and avoid making judgments based solely on imaging findings. Conclusion. In this report, we discussed the new ways of viewing and thinking about Mr. Eye images, which is crucial for a deeper understanding of sciatica. I hope this knowledge proves useful in your daily clinical practice, in your explanations to clients, and in organizing your own understanding. Of course, the approach to sciatica involves much more than just interpreting MRIs. It encompasses diverse perspectives, including Eastern medicine, various manual therapies, and exercise therapies. I plan to continue sharing information useful for your clinical practice. Thank you for reading. If you found this video helpful, please like and subscribe to support the channel. I'll keep sharing traditional Japanese healing wisdom and tips for better health. Thank you so much for watching until the end. I really appreciate it. See you in the next video.